Hi, everyone. Welcome to the EHMA podcast series, Health Management Voices. My name is Zach Dessen, and I'll be your host for today's episode. With this series, we want to offer the European health management community a closer look at real-world experiences and challenges faced by health managers, covering a wide range of different topics. This episode's focus is bridging health inequalities, boosting literacy in marginalized communities through community-centric approaches. I'm happy to have with me today Val Albrecht, registered midwife at Ottawa South Midwives, who brings a wealth of experience in public health, health service delivery, and health communication. So let's get started. Welcome, Val. How are you?
I'm great. Thank you so much for having me. It's nice to meet you.
Very, very nice to have you. So I would ask you if you could just start for us by sharing a little bit about your journey as a midwife, what led you into the profession, and then what inspired you to work at the practice that you do now.
Sure. So I started my journey when I was exploring motherhood. I had 2 children already, and I just felt like there had to have been something different out there. And when I was pregnant with my 3rd child, I found midwifery and was able to have the experience of having a midwife throughout my pregnancy and my birth. And I realized that that was the difference for me. And it really cemented the kind of care I wanted to see other people have. So that was my journey beginning when I realized that there is a different way to do things. There is a choice for different prenatal and obstetrical care that is available to other women and families. So as far as the diversity piece goes, I did originally start in a practice that there was not a lot of diversity. It was a smaller community. Since having come to this one, I have been blessed to really be able to be part of a diverse community, both with the co-workers I have, as well as the clients that I serve. I am somebody who is so nosy. I'm very, very curious. I want to know what makes people tick. I want to know what makes them think. I want to know how they see the world and what their experiences are, and how those experiences cause them to see and experience their healthcare journeys. So that's why I really enjoy working in this diversity.
And I can imagine too that you have a lot of people coming through the door. And like you said, there's diverse backgrounds, diverse amounts of health literacy and knowledge about prenatal care, what their options are. So maybe just even as a fun fact or an interesting story for the listeners, like what are some things that people come into the door at your clinic and maybe they don't know that we would on the outside, not being midwives, not being involved in maternal care, that we would kind of assume most people would know?
So there's a few things that we choose to do differently, at least at this clinic, and I can't speak for all of them, but for ours, we have removed as much of the barriers that we can. So for example, when families come into our clinic space, the waiting room and our clinic rooms are directly connected. So the midwives will come out to the waiting rooms. They will invite the families in. There's no barriers for them that they have to jump through a number of people. They see the midwives interact with each other in front of them in the waiting room. We're laughing, we're joking. We build this sense of community in the actual waiting space. So even before the clients come in, and that's something I'll point out too. We use the word clients. We don't use the word patients. So that is something else that we've changed in our language. So when the clients come in and sit in the waiting rooms, they see this diverse group of women already speaking to each other and having this connection. And they come in and go, wow, this place is very welcoming and warm. And we feel like we can fit in because we see people that look like us and we see people that don't look like us working together. So I
And I
think
know,
come in with
and I
that.
know you have quite a diverse team of coworkers at your practice. So how do you find, or how have you seen that that impacts the client experience? I'm sure that some of your clients have maybe made comments directly or given feedback that maybe it's nice to see someone who really understands their cultural background. I wonder if you have any stories or insights about that.
Well, definitely. I think that it is when women see women in healthcare providers that look like them to begin with, that right away gives them a sense of comfort. And then when they see these, myself being very, very white, interacting with somebody who is Muslim, we have Muslim midwives, we have midwives from Africa, we have Chinese midwives. They see us interacting with respect and dignity, and they really appreciate that. And where it helps is that because we don't have enough Muslim midwives, we don't have enough Black midwives for clients to have only a Black midwife or only a Muslim midwife. So that unfortunately for them, because that's what their preference would be, they have to accept that we are their midwives too. But they have made comments saying, "Oh my gosh, I really appreciate seeing that you and this other midwife interacting, and I know she's answered, a page for me or a call for me, and it makes me feel like you have an understanding of who I am and where I come from." So the comments are made, and even from midwives, for example, I just had one of them say to me, "I went out to the waiting room as a Black midwife and called in a Black client, and the Black client was surprised pleasantly that this was a midwife that looked like her." And she really appreciated that and was commenting on that.
And I think I can imagine it makes a big difference because you have a lot of people from different backgrounds who maybe don't trust the healthcare system because they've been treated poorly by doctors or by nurses, people who don't really understand maybe where they're coming from culturally. And I wonder too, because you must also see lots of people with really different levels of health literacy. So people
Mm-hmm.
who don't know anything about what it means to be pregnant, what the implications for their health really are. And then I'm sure you also have people who come in who have read 20 books on the subject and maybe want to try and tell you how to do your practice. So
Yeah.
I wonder how you negotiate, understanding where the client is when they come to you and how you kind of guide them through their journey.
Well, the first step is to find out where they're coming from. That asking them the questions about where they're getting their information from is really important, because a lot of cultures, they put a lot of emphasis on what their families tell them and what their communities tell them. So you're providing some kind of information and they will say they will be resistant because their mother, their sister, their aunt has given them other information. So this is a very cultural piece that we run into all the time. And it is, you don't want to say, "I'm sorry, they're wrong," because that doesn't, they put a lot of respect into these people and what they say. So trying to balance and rephrase and discuss in ways that are simple enough that they can understand what you're trying to convey around what kind of care they need or what is happening in their pregnancies, and at the same time being able to acknowledge the information they're getting from the people that they really respect. And it is a very fine line. You have to be very careful, because if you push too hard too fast, you will alienate these people. They won't come to you as the expert. They will turn to their family members as the expert, their community, their friends. So just navigating that can be very challenging. So that is a piece we try to, I guess the word sometimes is, we do feel like we're tiptoeing around all of the things. And then also making sure they understand there's some things that are no harm, no foul, cultural beliefs. So, bringing that in and allowing that cultural piece to still exist in their care.
And I know you also have a piece in your practice where you're not only trying to help clients who have lower health literacy or different levels of health literacy, but also people who are brand new to the health system, that they don't necessarily have any experience accessing health services. And you're also trying to kind of bring them in and teach them how it works. So I wonder if you could share some of those experiences.
No, for sure. I mean, we get these people who arrive at our doorstep who, they've had to leave their country for war or for other very difficult reasons, and they show up and they don't have OHIP, they've claimed refugee status, they don't speak the language well, they are so overwhelmed by all of the systems that they're being put through, and now they must all of a sudden navigate a healthcare system because they're pregnant. And so we want to walk that journey with them and help them arrange all the things they need as needed. We help them understand what tests we need to do and where to do them and how to do them. One of the things we have started also doing in this practice is we do a lot of our own blood draws. So if we have a client who shows up and they come with no records, they're 7 months pregnant, we have nothing on them, we can just pull out our blood draw and do the blood draws and miss some of the steps and allow us to get the information we need without asking them to suddenly navigate the lab system or any of the other systems in place. So we also have the ability that's very specific to our profession that will cover some of the costs that come with someone who doesn't have health coverage. So, and we have team members in the community who honor those for us as well. We have certain ultrasound clinics that are on board. We have certain labs that are on board. We have obstetricians, because sometimes a woman comes in and their care is more complicated and we need to bring in another team member. We have OBs in the community who understand their predicament and will, try to step up and keep the costs low based on these people not having OHIP. So we do have quite a few community team members too that help with that, but definitely trying to remove as many of the barriers that they would have to do themselves, and us stepping in and helping them and navigating some of it for them.
And just for our listeners to note, OHIP is the Ontario Health Insurance. So just as a point of reference. But I find it interesting actually, because you mentioned that some of these people they arrive pregnant, and it's kind of they're being forced to interact with the healthcare system. And so I'm thinking not even just refugees, but also younger women who have been healthy, have had no reason to go frequently to the doctor or to the hospital. Maybe their pregnancy is also kind of their first long extended interaction with the healthcare system. So do you find that your service to your clients almost can act as a gateway to either being able to trust the health system a little bit more, or helping people to navigate the different services?
I think there's both involved depending on the situation. Definitely there are people who've never been to a hospital, and so this is not only are they newly pregnant trying to figure that all out, they're also trying to figure out, what do I do? How does this work? And then there's the other end of the spectrum where we have the women and the families who are living in poverty, they're living in the system. They have a huge distrust of the healthcare system. They have a huge distrust of healthcare providers, because their experiences of this sort of hierarchical, it can appear hierarchical anyways, healthcare system is threatening to them, and they feel unsafe speaking with doctors because they don't trust them. They don't know if they're going to report them. They don't know if they're going to get safe care. They don't have that sense. So trying to take these people who are already in this situation and helping them navigate the system in a way that is as safe as possible for them. Truly, they come from a place where it's never 100% safe, but we try our best to make it a little safer for them. And hopefully by the time they're done with us, they see that there are also something different for them.
And I wonder if you might have a story you could share. I don't want you to obviously infringe on anyone's confidentiality if it's a bit too personal, but maybe of somebody who really came in distrustful. And obviously, as midwives, you are a bit more closer to the community. You go to people's homes, you kind of see them outside of these institutional settings for the most part. So I wonder if you have a story that comes to mind of someone who came to you very distrustful, and then maybe it took some time, but we're able to kind of gain a little bit of trust and faith back into the healthcare system.
And what you just said there is really key a little bit, because the truth is we're not going to fix this. It's systemic, it's huge. These are people who are distrustful of all organizations. They lie all the time. They don't show up for appointments, and that's not who they are. It is a symptom of what they've experienced, right? And we're trying to keep that in mind, that when someone lies to you and someone's dishonest or they don't show up for appointments, it's not you, it's them struggling. So there is someone that I've had who have had several babies with her that she's come to me. This is someone who has very much been part of the system. She's had different involvement from different organizations, does not trust anybody, lies to me. Even through all of it, she continues to lie to me. She continues to be dishonest to me. And I try to be, empathetic and see where she's coming from, and not being harsh or judgmental, because that's not what she needs at all. She needs somebody to finally look past all that for her. But this is someone I actually had to get in my car and go and find, because she hadn't shown up. This was the first pregnancy with me. So she hadn't shown up for a couple of appointments. She wouldn't answer her phone. We couldn't get a hold of her. I went and tracked her down, found an address that I had in our system. I went there. It wasn't hers, but that person knew where she was. Then I was able to find her. And I feel that the investment that I put in for this person to connect meant a lot. Even though she continued to be dishonest, she continued to not show up when she said didn't do the testing, but the connection was there. There was a little kernel of trust that had been built, and we got through that pregnancy, and sure enough, she returned for a second pregnancy. And again, the same thing, but we worked through it. We understood where she was coming from, and that's just what we try for, that little bit. That's all we get. We'll take it.
No, and I mean, at the end of the day, they can only give you what they're going to give you. But it makes me think, because you mentioned a few minutes ago that you have a lot of community partnerships in place. So some of these other clinics or OBs or maybe even social workers, you have some sort of connections in place to kind of expand your network with, as you work with people, you know which services they need, but you also know some people there who you can connect them with. I wonder if you found any of these particular partnerships valuable more than others. So are there, maybe knowing social workers has been really good for connecting with different types of clients, or maybe knowing people at the hospital has been particularly helpful, or maybe they all have their own role to play. I'm curious how you see the bigger picture of community integration.
Yeah, and it can be quite complicated, because with confidentiality, we cannot just give someone's name to someone else and say, give them a call and check in on them, right? So checking in with the families and going, are you okay if we share your name with this? And often some of the people that have a big history with these services will say, oh no, I'm good, thanks, I'm good. So in some ways you're stuck without that extra support for these people, and there's not really a whole lot you can do. You just do your best. In the cultural piece, there are some really good resources with some of the social workers, the public health people who have a lot of connections, and they have a lot of information and for these people, and helping them find other communities that they can join. So that culturally, the ones who have more of a cultural difference tend to be really open to having those opportunities, because they're usually quite alone. They feel alone and they're not sure where other people are. So they're all open to those as much as they can. But honestly, the people who could really probably use it the most are not often open to accepting those.
Okay, and I think I'm gonna give you a challenging question to finish us off here. So forgive me, but I'm gonna ask you, because we'll speak to the any other healthcare professionals who might be listening to this podcast. And if you could give them one piece of advice about how to make your practice more community oriented, how to be more welcoming to people from all kinds of different backgrounds, could you give them one piece of advice or kind of one key message?
Oh my gosh, you're right. It is a difficult question because I'm not sure there is just one. There are a few things I feel that are important. I think that each practitioner needs to really honestly explore the barriers they have in place themselves, whether the barriers be physically, like their clinic space, or the barriers are mentally. So, judging, are you being harsh in your judgment? If somebody doesn't show up, do you write them off and just say, well, they couldn't be bothered to show up? Or thinking about it from a different perspective, because yes, all of our time is precious, but these are people who need that. This is something that will make a difference in their lives years after they've left your care. And coming to this with curiosity, come with curiosity, listen, be humble. You're going to say the wrong things, you're going to do the wrong things, you're going to make mistakes, but someone would prefer that you say, I'm really sorry I messed up there. What do you need from me? What can I do to change this for you, to make it so that this is easier for you? And listening to what they say, coming to it with curiosity.
Well, I put you on the spot for that one, but thank you for the beautiful answer in the end. And I think that's a great place for us to wrap up. So before we go, I would just like to extend another big thank you to today's guest, Val Albrecht, for sharing your valuable insights today. And I thank all of our listeners as well for tuning into this episode of Health Management Voices. We hope today's discussion provides valuable insights for our listeners across Europe and beyond. For more information on this topic and to stay updated on future episodes, please visit www.ehma.org or follow us, Emma, on LinkedIn or X. And on behalf of the European Health Management Association, this is Zach Dessen signing off. We look forward to exploring more important topics related to health management with you on our upcoming episodes. So until then, stay healthy.